There's a long experience. Ebola has been out there since 1976. There's a lot of experience in terms of how it's transmitted. I think that the CDC and everyone is very confident in how it's spread. There is some discussion among some experts looking at these other things, but everyone feels confident we know this is spread from direct contact with blood and body fluids, and it's droplet spread and contact spread and not airborne.
We all realize that there's still only a handful of cases here in the Texas area. You have a better chance of getting hit by a car today in Austin than you do catching Ebola. But how do you keep people informed without, just adding to the panic, so to speak?
We're trying to educate people regarding Ebola virus, how it's spread, what we're doing about it, and this is again part of what we do every day in public health. We deal with infectious diseases. We follow up on reported diseases. We follow up on those contacts. We do up the contact tracing, and so the control and management of that is something we do, and we've dealt with, in public health all the time. It's a scary disease because this is the one that's in the movies, it's in the books. The situation in West Africa is very frightening, but some of the conditions and some of the reasons why it spread that way in West Africa are very different from here. And so, we know, again, until we get that situation fully under control, we can't bring the risk down to zero for us here. But we know we're monitoring it, we can control it if we were to get a case. And again, I think you've heard, we are prepared.
We've inventoried our stockpile of PPE. We've ordered additional protective equipment early on, before even the first zero case arrived in Dallas. We've ensured our stockpiles are secure. We've given training to our crews, provided extra PPE to their supervisors who will respond out to the scene with them, because there will be extra PPE needed for either cleanup or other things. And we've just been continually pushing out information to our staff about the donning and doffing of the PPE, and that's the most important part.
What kind of training, extensive training, are you giving?
Well, the PPE that we're currently using, and it's recommended by the CDC, is the same PPE that they learned in their early on before they became paramedics and EMTs, and that we use throughout our career here, whether it be for influenza or for any other communicable diseases. So it's not new PPE we're utilizing, so they have done this over and over again. We're just adding additional training. We have a CE, continuing education cycle, coming up where we're going to be going through it again and going through a buddy system. We provided a video, but this isn't something new. This isn't something that's just all of a sudden, here it is for the first time, 15 minutes learn it. This is something they've done over repeatedly. In prior years, we've dealt with H1N1, influenza virus. There's other viruses out there, and they should be utilizing this all the time to protect themselves.
This is an effort to try to get good, solid information from healthcare professionals to the people, as opposed to just rumors that fly around out there and, from various sources. But thank you all very much for coming.